surgery day. It's 4:30 in the morning. I'm about to get up and shower. I slept pretty well. I think I went to bed at maybe like 11:30, but I doubled up on my muscle relaxer and I took Benadryl, so I do feel more rested than I felt all week. Still tired, but my body is physically like calm. Yeah, I'm just ready to get this over with. I miss my bed already and I haven't even gotten out of it. I don't know how much of today or this process I'm gonna vlog, so sorry in advance for any slacking. I hope I don't get copyrighted for whatever this music is, but I'm waiting for my friend to go park and then we're gonna go in. Just a little check-in from my castle. Surgery was yesterday. It went really well. My doctor said it went better than he expected. He said all of my anatomy was very forgiving. And didn't really like fight him at all, which was great and a shocker. My pain, we're still working on managing. Yesterday they gave me Dilaudid, and that didn't do anything, and then they gave me morphine and that didn't do anything, and then a little bit later they gave me Percocet and Flexeril, and that didn't do anything. I think partially because I am on low dose naltrexone, but I told them that during my like pre-op 2 weeks ago, and you know, I'd asked the lady on the anesthesiology team if I needed to stop the LDN, like, you know, so many days or whatever prior, and she said now the protocol with LDN is to just like have patients stay on it, but I do think it's been interfering with my pain management, because if you don't know, low dose naltrexone, well, naltrexone itself is for like overdose recovery or drug addicts. It tries to like cancel out the effects of opioids. So yeah, but I just got some more Percocet and another muscle relaxer maybe like 30 minutes ago now. My drain and everything looks good. Trigger warning if you're easily grossed out, but there's like not a lot in it, which is great. My feeding tube feels fine. Yeah, it's more so obviously just the pain moving around, but I've also been getting like mini spasms on the left side, which of course like clamps, makes my muscle like clamp against the feeding tube. But yeah, no signs of infection or anything. I'm currently drinking blue Gatorade. It's just to make sure everything internally is going well. So once I finish it, they'll monitor me for 2 hours, and if nothing blue comes out of my drain, I could get my drain removed today. Nutrition is coming by later to start using my feeding tube and set up home health care. But yeah, I am about to get up, use the bathroom, shower because I would love to be clean. I can't shower for like the first 24 hours and I'm like coming up on it, so yeah, I'm gonna go take my little shower. It's really just my abdomen and my back that hurts really bad, but yeah, I do think that the pain meds that I just took are trying to help a little bit. It just feels like a crampy, stabbing kind of pain, especially when my bladder even gets the teeniest bit full, but everything is good. I am super hungry and I am having so many cravings right now. Once I speak to nutrition today, depending on how quickly they can get the home healthcare stuff rolling and seeing if my drain stays clear, then I might be able to go home tonight, which would be awesome. If not, it'll be tomorrow or Friday. But yeah, I probably won't have to stay until Friday. So this is what the drain is connected to. There's like a tube. You really can't see that at the bottom. And then my other 1, 2, this is incision number 3. And then 4 is over here. They didn't go through my belly button, God bless, because I remember having my endometriosis surgery a couple years ago, and I've always been an itty outie. I've always been obsessed with my belly button, and they obviously like ruined it for a while, and she bounced back. So I know for my next lap she will have to go through my belly button, but yeah, so I still only have 5 incisions and this is my 5th. Versus if I wasn't getting a feeding tube, he probably would have gone through my belly button. I can definitely tell that my community's been praying for me, because I went from just being so anxious and frantic and suffocated to, like, when I woke up yesterday morning to come here, I was like so chill, and it was really awesome. Just such a great support system out here. I feel the love. Praise Jesus. I really haven't done much since I checked in last. I did shower. I've been going to the bathroom pretty frequently, which is great. I haven't been this hydrated in a very long time. I literally just want to put a teeny bit of concealer on and some lashes, just feel a little more human, but I don't feel horrible. We are hooked up to my feeds now. We're going at 10 milliliters an hour right now. So far, I'm at 50 milliliters total. So that's great. And I was able to drink a little bit of chicken broth. And I had like 2/3 of a cup of jelly. Fine. I mean, my stomach kind of feels, or like my lower abdomen feels a little distended, but I'm eating, so it's just a feeling. I'm like not concerned about the feeling. It's just something that I will have to get used to again. Maybe like 10 minutes after we started my feeds, I started getting really, really fatigued. It's definitely a feeling that I did not miss from my NJ tube. I will say though, my throat does hurt pretty bad from being intubated yesterday during surgery, which they warned you about. Again, it's not something I'm concerned about. It just is a minor inconvenience. I look rough, but I am back home now. I don't think I filmed anything when I got home yesterday. I've just been so tired and I didn't get a lot of like in-hospital footage either because it was just a lot of sleeping and trying to gently move around. So I'm doing all the same things here. Home health care should be here in like 45 minutes to an hour, and she'll show me how to use my pump and everything and probably hook me up to feeds for the day. She said she usually brings 10 days worth of supplies and then obviously the company will ship the rest. I think like monthly. But yeah, I'll have more info when she gets here. I think the biggest thing I'm struggling with right now is gas pain, which I was obviously warned about, but I definitely forgot how bad post laparoscopy gas pain is. And most of it is sitting in my chest and like my upper stomach here. I'll have a few like teeny little burp bubbles, but that's it. Like I feel like I just need like a full-on belch, and I can't. It also helps that I can't like flex my abs, not just because they hurt, but literally there's holes in the muscle tissue. So even if I wanted to, I physically cannot voluntarily squeeze my abs. So I can't do anything to help the gas that's trying to run up. But yeah, it's just really uncomfortable. I can like kind of hear it in my voice. It sounds disgusting. Hard to clear my throat either. My back is killing me. I just took pain meds and Gas X and Zofran. I've also been getting up so frequently to go pee, which is good because it means that I'm hydrated, but obviously I'm not used to that. So that's been an adjustment, but otherwise everything's going fine. Back look so ghostly. This is like terrifying. Clearly I have my pump now. Home healthcare, the home healthcare dietitian just left maybe like an hour ago. She showed me how to use my pump, gave me my supplies. I'm flushing now super slowly because it's not even fully nauseous. I really felt like pretty lethargic today. Yeah, the gas pain is whipping me, and I don't know, it's definitely nap time. So once I finish flushing, I'm gonna connect to my pump, and then I'm on feeds 24 hours a day. So I have to do 2.5 cartons every 12 hours. And then at the 24-hour mark, I'll completely throw away my feed bag and change it out. So this is the setup for now. I mean, that's pretty much always gonna be the setup. I also they bought me an adapted backpack, and it's not as ugly as I thought it would be. So I'll probably use that. I do still at some point want to adapt my backpacks. Yeah, because it's just nice to have things that don't look so medical. Yeah, this is really painful. Okay. I know she said 50, but I got 20, and yeah, I just can't. That's like all I've got. Connected. Okay, now I'm going to, and I'm running. I need a nap. Kaylee's coming over a little bit later, so I just want to be slightly less of a zombie when she's here. So that's my cue. We're all hooked up and ready to go. And thank you, Jesus, that I am home in my comfy bed. I also need to take a shower. So after this little power nap, I'm gonna hop in the shower. I have a not so fun little update. Trigger warning if you don't like gore or vomit, because obviously I wasn't planning on that. It's been like such a crappy day. Yesterday I started my feed at 2. I like took a little nap for like maybe an hour or 2, and then Kaylee came over. I was like fine when she was here. And then I like immediately got super fatigued when she left. So I just took my meds and laid down. I have to change my bag like refill my bag every 12 hours and change it every 24. So I refilled my bag. I got up at like 2 a.m. At this point I was on 20 milliliters an hour because they told me to titrate up 10 milliliters every 6 hours. But the 20 felt like too much on top of the gas pain, because my abdomen just felt super distended and I was like nauseous and kept trying to burp and couldn't burp. So I only refilled my bag a little bit and took a couple hours of a break. And then when I plugged back in at like 4 in the morning, I went down to 15 milliliters an hour. So I had essentially been on that from 4 a.m. to, I want to say like 1 or 2. I obviously flushed in between. I've been like in so much pain all day. I've been so lethargic. Only times I've gotten out of bed have been to go to the bathroom, and even that's been like really hard. Like most of today this is like the first time I've been able to like keep my eyes open truly. Yeah, just a lot of tossing and turning. I couldn't take my morning meds this morning because I was in so much pain. So yeah, at 2 o'clock, like right as I unplugged and finished flushing my line, I like sat up thinking it was gonna be a big burp and it was green vomit. So I just called the nurse from my healthcare company, and she said I can stay home, but to take a break for a few hours and then start back at 10. Stay at 10 for the rest of the day, and then when I wake up in the morning, try to go up to 15 and see how I feel. She said I do, however, need to go to the ER if the gas pain gets any more intense, because I already told her it's been pretty bad. Like if it comes up and I can't burp, it gets stuck and it feels like it's choking me. So like my stomach feels so much better now that I've thrown up. Obviously my J-tube site is sore. It is bleeding a little now. Nothing crazy, just obviously trauma. I don't know. I just feel a teeny bit defeated. And I'm trying to be patient, but this is content.
Hey.
That looks scary. There's currently poop coming out of my stomach.
A lot of it.
That's the only update I've got.
She got like the younger generation. I would never think to take a phone and take a picture.
Content, baby, content.
Your surprise clip. You're doing amazing. You're getting an X-ray right now, but I'm so proud of you. I love you.
Unfortunately, we are back. I had to get an NG tube on top of my J tube because my stomach was super distended and needed to be compressed, which means just letting out any gases, liquids, anything that have been trapped. And so far they've decompressed over 2,500 milliliters of fluid from my stomach, so that's fantastic. This is not the same nasal tube that I had last time. The one that I had last time went to my intestines to feed me. This one is strictly in my stomach to suction things out. My throat hurts so bad. Somehow getting this in was way more painful than getting the NJ tube in, but got all that done in the ER, and now I am checked back in. I'll see my doctor tomorrow and we'll kind of talk about what I need to do from there, but I already feel way better having all of these gastric contents no longer in my stomach and being on pain meds that are actually working for once. I'm gonna try to make this quick because my throat hurts. I'm exhausted, and this is not the update that I wanted to be giving. It's Tuesday. The NG tube is still in since Friday. We've still been draining bile from my stomach consistently since then, and I have to go in for surgery again in a couple hours because we haven't been able to get my bowels fully moving. Sunday was probably the worst day of my life. Long story short, a GI contrast, a suppository, and 2 enemas, and I still could not poop. Let's just call it what it is. I haven't been able to run feeds since then. Yeah, so I haven't run a feed. I haven't had proper nutrients since before surgery. I haven't been able to run a feed since my attempt on Thursday/Friday, and I just got taken off NPO yesterday, so I'm clear liquids because it'll just get sucked back up, but we were really trying to get my bowels to move for themselves. I don't technically have like a physical obstruction from my own anatomy, but I have so much stool in my intestines that in itself is just a whole obstruction. After everything we tried on Sunday, yesterday we just were pushing colon prep or colonoscopy prep straight through my J tube to help get things moving. It was trying to work, but it just still wasn't sufficient enough. This is also TMI, but maybe just a couple like quarter size loose stools. Only twice after pushing Go Lightly for 18 hours yesterday. The surgery I'm having today is he just has to manually go manipulate my colon and see if he can get as much out as possible. Hopefully start a feed, but if I'm still symptomatic and just not absorbing much from my feed this next day or so, we just have to start TPN. I'm so exhausted. I've been going through so much the past few days. No sleep, lots of pain, having to like ration pain management. Not because they're like forcing me to, but obviously narcotics slow down your gut motility, so I've just been weighing the benefits, and yeah, whatever I can push through, I try to as long as possible, especially when I started feeling like things were moving. But yeah, life support and multiple organ failure is definitely not what I had on the cards for my early 20s, and your girl is struggling.
Okay.
Okay.
Yeah.
Being good?
I'm
Okay.
pregnant.
Mm-hmm.
Okay.
Yeah.
You want to do it?
That's my
As
girl.
long as
She's
you're
seen a lot of me.
Huh?
That's my girl. She's seen a lot of me.
Okay, here, just in case.
Okay.
Some people, can you put your glasses up?
Yes.
Okay. Each other. There we go. What?
What's up, Abby? Hey, girl.
All right, you ready?
Yes. Ah. Oh.
Sorry.
Oh,
Wipe
thank
your nose.
you. Thank you. Thank you.
Yeah. Gotta.
You came right on time.
Oh, you right?
Ugh.
Any blood? Good. Any blood in there? No.
A little bit on the towel. Ew, I'm wet. Hold on.
I'm sorry.
Oh, that's okay.
Yuck.
No, it's not you.
You get it?
It's me.
Oh, yowie.
It's me.
Yeah.
It's not you,
Oh,
it's me.
oh.
It's not your blood. It's
She
mine.
wanted it to happen so bad, but it was all.
I get it.
Doesn't look pleasant.
Okay.
Wow. My two least favorite color is red and green. It's all I've seen this week. Sick of it. A little update. The tube is out. Well, the nose tube is out. I still have the other really important tube in. I had Abby go to my house and grab me some things and had her grab my tubey clips. So it's super fun to get to use these. I'm feeling, at least emotionally, a lot better right now. I had my friends come over earlier. I got to see Abby and Ava, and then Miss Donna just left. And yeah, it's always just super good to see my people and just be filled up with life and laughter and joy. So really appreciated that. My head hurts so bad. I feel so dehydrated, partially from crying all morning, probably also partially from this coffee. I really didn't drink but like 2 or 3 ounces of it, but I will say it is helping move my bowels a little bit, which I appreciate. I think also just probably the fact that it's liquid. It's so nice to actually be able to drink things again. My throat still hurts pretty bad, but obviously not as bad as when there's a tube in it. And I guarantee by tomorrow I will feel significantly better. We did start my tube feeds. Yay. Been banking on that. We're only at 10 milliliters an hour for now. And then obviously flushes as well. Feeling exhausted from that. But yeah, we're just gonna monitor like my pain and stuff. Obviously make sure that I don't get insanely nauseous. Definitely make sure that I don't throw up. And as long as things go well the next 24 to 36-ish hours, I should hopefully be able to go home tomorrow night or Friday morning, which would be amazing. Yeah, I don't know, today's just been like such a mixed bag. Yeah, long, painful, emotional night and early morning. But then, yeah, having my friends here, just, yeah, every day, like, people have shown up and showed out for me, and I just really appreciate it. It makes a huge difference, to, like, both have people that will, you know, like, bring you joy and kind of get you out of your head, but also, when you need it, who will, like, sit in your grief and sadness and crying. The chaplain came by today. Turns out he also goes to my church, which is super cool. So I told him I'll definitely be on the lookout for him. But yeah, it was super sweet to actually like get to have a conversation with him and just talk through some like faith and grief tensions and, you know, faith and chronic health tensions and all the things. It just really, I mean, obviously, I feel like I say this all the time throughout my whole life, but definitely this week, but definitely today, I've just seen God show up and be so specific in how he acknowledges that he hears my prayers and my friends and family's prayers and my desires that I like haven't even yet turned into prayers. The chaplain and I were talking about that too, like how hard it is when you know that like Jesus has done so much for you And, you know, obviously he understands that, like, I'm chronically ill. He understands the brain fog issues and struggles and the exhaustion and the fatigue and all the things, but you just want to be able to, you know, give him your heart with intentionality in a, like, purposeful way. And I feel like I've been struggling with that when it comes to, like, constructing my own prayers and, yeah, just facilitating conversations with God in the way that I used to, in the way that I know that I've been capable of before. It's a struggle when you just feel like your brain is just, like, not there all the time. But yeah, anyways, yeah, that's about it for now. But no throw up. My tummy hurts and I'm nauseous, but I'm just gonna take it easy for now.